So I hope you will already know, and if you don't already know it, that you'll take my word for it, that the PEPFAR leg of the stool is strong, and that faith-based organizations are critical to it in a couple of ways. But let me get to these other two that are perhaps less in your everyday life, or less on your front burner. So let me next turn to multilateral and the Global Fund to fight AIDS, TB, and malaria. Again, advocacy for resources is important. They are funded out of the same appropriations bills as PEPFAR and as other global health activities. So I hope you will also remember to mention the Global Fund in your advocacy work, because it's really important. But it's also the case that in countries, the faith-based organizations are often members of the country coordinating mechanism that decides where the Global Fund, that submits applications for Global Fund money, that decides where the money is going. Now, I have to say, among friends, the Global Fund has definitely had some issues over the years, but it's really gone through a very dramatic reform effort in the last year and a half, led really by the US. And we feel more hopeful than we've ever been about its ability going forward to really deliver results, to really have a huge impact. So this is not the time for the US to back away from our support for the Global Fund. And so we hope that in your advocacy here, you'll be aware of it, but also those of you who are in organizations that work in the developing world, that you are making sure your organization is involved in guiding the Global Fund grant in country. Okay, so that's second leg. Third leg is what countries are doing. And this is really the most important leg, because external resources are critical, but it's really countries that have to be in the lead. We use this phrase country ownership to describe this. So of course, faith-based organizations are doing the actual work in countries. That goes without saying. But they also have the ability, you also have the ability to advocate for more resources from the governments of these countries. As Ariel mentioned, we have fast-growing economies in the developing world, in Africa too. And so is that money being sent into the health sector by the governments? Largely, no, not yet. So how is that going to change? Really, by the people in the countries pushing for it. It's going to, we can help from the outside. We can cheerlead and encourage, but the faith sector in the developing world needs to get into that dialogue with their governments about resources. And this comes up with Congress all the time. Congress doesn't just want to know, are we doing a good job for these countries? They're glad that we are, but they also want to know, are the countries themselves stepping up? Because it's nobody's vision for the U.S. to play the role of Ministry of Health for these countries forever. That's not, that's not something we can really sell. So I want to highlight that advocacy role in country. So back to this consultation I mentioned in Nairobi. So we had 4 countries there, and one of them was Rwanda. Rwanda, a fascinating country, unique in a lot of ways. But we had representatives from all 4 of the governments there, including Rwanda. And the woman from Rwanda said, well, our approach to faith-based organizations is to fund them exactly the same as our own government facilities. So we hire and pay for the staff of all facilities, whether they're government facilities or faith-based facilities. And so we have people then from the other 3 countries all putting their heads down and taking notes. They're like, we would like that too, So it's just an example of what I think what we would like to see in terms of the governments in the developing world really embracing and recognizing the contribution of faith-based organizations. It's not enough for us to do it from the outside. So my last point is the AIDS 2012 meeting is taking place in Washington at the end of next month. So this is the big biennial conference on AIDS. Hasn't been in the States for over 20 years, but is returning to DC, and what better time than the end of July in our nation's capital. It'll be a warm welcome, that much we can say. So you'll certainly start to see a lot in the press about global HIV/AIDS, and so I hope you have, after this conversation, and we'll talk some more in the Q&A, some orientation as to kind of where the U.S. fits in that global picture, which is an important part, but not the whole picture of the solution to an AIDS-free generation. We need these other legs of the stool to work as well. And then the faith-based contribution on AIDS is going to be highlighted. There are several different side events and a formal session at the conference. And so those of you who are participating in that, thank you for doing that. It is a fairly overwhelming experience, 20 to 30,000 people, descending on a city for one of these. And a lot of the activity is somewhat circus-like and somewhat alienating, at least to me personally, at the one I went to 2 years ago. So I'm encouraged to know that many from the faith sector will be there as well, putting forward positive messages about the things that are working that we can do, because it's important for that to be told. So sorry, I think I've run a bit long, and back. I think it's time for Q&A.
Tremendous. Thank you all very, very much. Very powerful, I think, presentations. Would you all agree? Yes. Amen. Let's just do another amen. We are a church group. I also want to compliment this group as the group downstairs getting settled. Unlike every church I've ever been to, people are actually sitting in the front row and not making the people come all the way up front. So I'd ask you to think about some questions. We have Mona. Is there someone else with we have two people with microphones. So it'd be very helpful if you speak in the microphone. And if you're directing your question to one of the panelists, to please identify that, or if it's for the entire panel. And as you're thinking about your questions and saying up, I just asked the panel, does anyone have a quick comment about anything they heard from one of their colleagues? Did something strike you that you'd like to reinforce or add a bit of a comment to? And then we'll jump right into the others. Nothing? You good?
Hi, Nancy Harris from JSI. I just would like anyone on the panel to comment on, because it's been part of this conference, the enormous growth of non-communicable diseases, and that does relate to HIV because they are related in terms of mortality, and what will be eventually the U.S. government response?
In terms of non-communicable diseases, there's been a lot of discussion on exactly what the U.S. role is going to be. I can tell you in this budget climate, there's the likelihood of a comprehensive NCD type of program, a new PEPFAR, a new President's Malaria Initiative, is extremely unlikely. In the immediate future. What we're hoping for is, as we increase the issue of health infrastructure, getting hospitals, clinics built, training medical professions, everything from MDs, nurse practitioner, physician assistants, nurses' aide, farm techs, phlebotomists, everything on down, increasing the lab capacity, being able to do more screen and treat, things like that for the whole infrastructure of the system. The old adage, rising tide lifts all boats, to sort of help the health infrastructure generally to take care of everything from diabetes, heart disease, to any type of infectious diseases.
Thank you very much. Great question. And clearly, with 60% of all deaths in the world due to non-communicable diseases, 85% of them in the developing world, this is becoming the big issue in terms of epidemiology. And at the World Health Assembly earlier this month, it was one of the highlights, together with universal health coverage as the aspiration for countries. USAID, for the reasons we just heard, has not put forward a big initiative centered around NCDs. Budgets will not be there to back it up. So we do have a strategy in USAID from our demographic health service measurement. We are now already beginning to document obesity, exercise, blood pressure, smoking, so that we can have measurement, because I think one of the big success, part of the success of the global health movement the last decade or two has been the fact that we have been able to document the problems, to document results. So that's a very important thing we are already moving on to do. Second is, as we just heard from Shellie, health system strengthening is becoming paramount. As a whole, as we are indeed, in some countries, we are indeed shrinking our footprint, and we need to make sure those systems are strengthened so that the gains in the problems that we have been working so far remain, but also so that they are capable to deal with new and future problems. So I think that that's very important, and a lot of the capacity that you have on the ground on behavioral communications, all of the health systems dimensions that we just heard before are important. And then finally, on some of the specific initiatives we have already, we are already beginning, our strategy already calls for, if you are going to be doing antenatal care, make sure the mothers give up smoking if they are smoking, or to encourage the husband not to be in the room, and so on. So there's a lot of communications and education that we're already beginning to do. And one last point on that sort of thing. I mean, we have vaccines too, and some of the vaccines, hepatitis B, used to be, liver cancer was the largest cancer in the world, and because of China. And of course now that's gone with hepatitis B vaccination around the world, as well now other vaccines that also have activities against cancer. And on nutrition, I would like to say that there's a sense that we are in this transition nutrition where we still have a lot of undernutrition, and at the same time we are beginning to see the beginning of a global obesity epidemic. Luckily there's a good science that suggests that by ensuring good nutrition in the first 1,000 days of life, that is pregnancy and up to the second birthday of kids, you actually preempt obesity in adult life. This is a very important science which allow us to really, by ensuring good nutrition today, the work that many of us are involved, we are already helping prevent obesity and all of the complications that come with it, diabetes and all the cardiovascular and some cancers and so on. So I think that we have some things in place already, but we hope that as we have a better moment in the budget situation, we can break through with a big program on NCDs.